This joint memorial comes from the people themselves, and they drafted the joint memorial. And as you know, Medicare is one of the star leaders of our country in providing human services to our elderly. Unfortunately, there's been a push to privatize Medicare over the years. It came about, I think it was part of probably President Johnson's Great Society programs, where he had a vision where, you know, with all the civil rights efforts through that time, making sure that our elderly were also included in that progress that our country was making. Well, since then, there's been this ongoing push to try and privatize that health care. So there's other programs that have come forward now, Medicare Advantage and Medigap and those types of things. But academia and especially the inspector generals have discovered there's been much fraud in the system from a lot of these private entities that are providing this coverage. So this, the program itself only charges, I think it's 3% overhead, but it allows the private companies to charge up to 15% profit. So nobody has yet been able to explain to me how the private sector with a profit margin can possibly do better than a public service and get the same value out of the programs. So this joint memorial simply asks Congress to level the playing field. It's not saying eliminate the private companies, just make sure that everybody's competing at the same level. And it also hopes to increase the benefits, provide dental and vision that's not included under your basic Medicare program. So there's going to be some speakers. This is their joint memorial, so I'll give my time to them to speak to this. But thank you so much for hearing this bill, Madam Chair.
Thank you.